This aspect of the podcast is developed so that we will all know basic anatomy and physiology. It's important for us to understand our bodies so that we know when it's functioning and when it's not functioning as it should. So here's the question that I'm about to pose. Should there be bleeding after menopause? Should there be bleeding after menopause? The answer, and this is important for all women to understand the answer. The answer is no. As a result of the decline in estrogen, the lining of the uterus becomes thin and inactive, and there should never be bleeding after menopause. If you experience bleeding after menopause, that is abnormal and a reason to see a gynecologist immediately. This is not hyperbole. This is very important for you to understand. In fact, abnormal bleeding, meaning bleeding after menopause, specifically bleeding after menopause, may be indication of cancer growing within the cavity of the uterus, uterine, or what we call endometrial cancer. And that can only be evaluated, confirmed through testing and being seen by a gynecologist. So therefore, I am saying that you should understand that postmenopausal bleeding is abnormal until proven otherwise. It gets confusing because often as we approach menopause, bleeding can become irregular. And when I say irregular, usually women will start to get a spacing out of their periods instead of coming predictably once a month. Periods space out so that they're coming every other month or even less frequently, which is why we say menopause is defined by going 12 full months without a menstrual cycle. If you stop for 2 months and then you start bleeding again because you're in the perimenopause, the clock gets reset. And then you have to go 12 months from that point before we can say that you have achieved or arrived at menopause. So therefore, it behooves you to track it once you start to notice that your periods are becoming irregular. And I suppose I should go back and say that once a woman starts to have a menstrual cycle, the expectation is that her cycle should occur monthly, on average every 28 days. That is the expectation. If you are a young woman and you are finding that your periods don't come every 28 days, or you find that your periods don't come on a regular basis, or you find that your periods don't occur at all, that you can go months without a menstrual cycle, and if it is abnormal, meaning you are not having a menstrual cycle on a regular basis, the reason for that needs to be determined because irregular cycles, irrespective of age, is not considered normal. And then when you reach the perimenopause, often cycles start to space out. Sometimes the number of days that you bleed lengthen. Again, track your cycle If it is abnormal, meaning not coming on a regular basis, meaning lasting longer than 7 days, that is a reason to go to the gynecologist for further evaluation. But remember that once you've arrived at menopause, again, meaning once you've gone 12 months without a menstrual cycle, you need to see a gynecologist if you start having bleeding after that point. This is very important. It may save someone's life by knowing this information. So share it with a friend. You should bleed once a month up into menopause, and then after menopause, no more bleeding. Monitor, document, see the gynecologist when needed. And until the next time, this is Dr. Rahman saying, take care.